We are delighted now to be joined by the doctor. He is from Beverly Hills Pediatrics. Dr. David Obudzinski joining us on the MegaCast. Doctor, welcome to the show.
Thank you.
Well, thank you for being with us. So, really, for the most part, most physicians have been doing telemedicine and asking people to stay at home for the past couple of months. Now we're getting back into offices, and that's good news. But what impact has this had on the pediatric community?
Well, we've seen a lot less children come in for their well visits over the past 3 months, especially when the pandemic started. So we had less children who were getting immunized at the regular routine well visits. And I'm worried about the infants, especially because those infants receive a lot of vaccines in the first 2 years of life. And so missing a visit means missing some of their vaccines that are important for them to be protected from certain diseases. And I think it's important that they come back in and they start scheduling their visits and get back to their immunizations that they need to have so they can be up to date. It was really tough at first. We were seeing a lot of parents who were very nervous, scared, justly so, about coming in. We tried to do what we could at the office, ensuring that we had separate times for sick visits and well visits. We try to also have increased amount of cleaning of the waiting rooms, try to keep people out of the waiting rooms actually in their cars until they, had rooms open. But it still didn't make a difference as far as people were nervous about coming in. We didn't really see a lot of children with, COVID-19. So we were seeing just regular routine visits in our office. So, but of course, I know the concern is that it's out there and parents were worried about that.
Well, and this is in a climate, and correct me if I'm wrong, doctor, but this is in a climate where we already are concerned, maybe not locally so much, but globally, about the routine vaccinations that we've been so good at as a community getting done. We have seen some erosion, if you will, in the numbers of folks getting their routine vaccines. Is that a correct assessment?
I think that there has been some, but in our population, the patients, there hasn't been a lot prior to the pandemic. So, there would, I would say, been a great reduction with the pandemic, just because of, again, because of the fear of people not wanting to bring their children in.
Dr. David Obudzinski joining us. He is a pediatrician at Beverly Hills Pediatrics, and we thank him for tuning in. Beverly Hills, of course, one of the communities we serve through Birmingham Area Municipal Access. So if you are in the area and you've not had your children in for their vaccinations and other just general checkups, do so. Beginning to see some reports, doctor, and maybe this gets a little bit out of your pediatric expertise and just would enjoy your general medical knowledge here, but we're beginning to see some reports, and I believe I saw an article in one of the Detroit papers today about some of the other side effects, if you will, or negative health results that have happened to people that have had a pretty severe round of the COVID-19 virus. And, there's still a lot we don't know, don't you think, doctor, about the impact of this disease?
I think we're still learning things all the time. Not as it was in the first part of the pandemic, where we're learning things daily. Now we still are learning things each week, about the COVID-19 virus itself. So I think that it's still not fully understood, the virus itself. But I think we have a better understanding, certainly, than we did 3 months ago. And I think that there's questions to be answered, especially as we move forward, as to whether or not, people who've had it, are they protected then? Will they have, adequate protection to be safe in the fall, should there be another outbreak, which we anticipate there would be. And we know that kids in general still have less intense disease. I mean, it's something that we still are seeing There has been this multi-system inflammatory syndrome that's been described in children, and it seemed like there were a lot of numbers, but we didn't really test, and we haven't really tested children overall for COVID-19. So we don't know out of how many kids who actually came down with it, how many had this inflammatory response. And it's been a response that's been treatable, which is good, as long as one realizes what's going on with the children.
Dr. David Obudzinski joining us. He is a pediatrician at Beverly Hills Pediatrics, and we appreciate him joining us today on the MegaCast. Doctor, I think it's safe to say that your kids are certainly not insulated from all this. Initially, we thought this is only going to be affecting COVID-19, that is only affecting the most aged and those with dangerous medical conditions, but we've seen there's other widespread impacts. And this all happens at a time, the most information that we have came at a time when our children were out of school, and most of them were at home. So as we come back into the fall, schools are open. I think it's safe to say that parents really need to be on guard to make sure that the kids are doing the same thing that everybody else is doing to stop the spread of COVID-19, because we just don't know. We don't know exactly what impact it may have, and you're not automatically immune if you're under 18. So I believe we've lost our...
I think that also...
There we go. Go ahead, Doctor. Your internet connection's in and out a little bit. We'll see if we can get a final comment from you. Go ahead.
Okay.
All right. Well, unfortunately, 99 out of 100 times this has been working really good, but his internet signal is in and out. We'll talk to the doctor again in another day.